lifestyle and diet are two huge factors in trying to balance immune function.
You're listening to the Ethos Athletes Podcast, where we believe that your health is the number one resource you need to accomplish your dreams. My name is Dr. Matthew Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, this is Dr. Matthew Hernandez, and you're listening to the Ethos Athletes Podcast. Today we're going to be continuing our series on secrets to performance optimization, and we're going to be focusing on immune function today. For this series, we've had Dr. Warren Brown, who is the owner of Clinical Advances for Sport here in Scottsdale, where he helps athletes go and perform at their absolute best by helping them manipulate some of the physiology and biochemistry behind their body. Dr. Warren, welcome back to the show.
Great to be back, Dr. Matt, as always.
We've touched on a number of different topics here, and we're on the second to last topic that we're going to be discussing, and that's going to be immune function. For those of you who haven't listened, we've touched on a number of different ones, from gut function to energy production, hormones, different things like that. So today we're going to be discussing immune function and how it relates to performance and the athlete. Dr. Warren, what are some of the reasons why athletes can have problems with immune function?
Aside from the high physical demands that they're typically putting their bodies through, they could interact. They could come across more pathogens, like if they're through teammates or through close contact with competitors, things like that. Their baseline health status has a lot to do with their immune function. Lifestyle, sleep, recovery, nutritional status is a big one, and stress levels, psychosocial types of stress, emotional stress. Those things all have an impact on immune function. So those are areas where I really try to make progress to try and balance immune function. A lot of people talk about boosting immune function. The way I see it, balance seems more important in immune function, just so that it's not overactive, like in autoimmunity, or underactive. Ultimately, we're not talking about anything super exotic here. A lot of this stuff is practical, stress management, et cetera, but and lifestyle and nutrition. But those are the things that I'm working on and seeing that athletes either benefit from or need help in those areas.
Yeah, that makes complete sense. And can you kind of define what immune function is in your eyes, and kind of what you're looking for with regards to that in an athlete?
Sure. Yeah. Immune function, basically, there is the classic type of immune function that we all think about with fighting off an infection. And then there's this other type of immune function that sort of helps modulate the inflammatory response. That where we're talking about cytokine production and inflammation, and that sort of ties into oxidative stress, which is something we talked about last time.
Yeah.
So I see the immune system as extremely complex, but also touching other body systems and being involved in other body systems, including gut health. We talked about detoxification and oxidative stress. There's a big component of the immune system that's involved there too. So it's a really complex body system. It's often overlooked in athletes. If they're not getting sick all the time, they're thinking, oh, well, my immune system's fine. I have no problems. But there are some athletes that really could use some help in balancing immune function, and then they see progress made in other body systems because of the interconnections there.
Yeah, and speaking of interconnections, you talked about when you were looking at GI function, how much that relates to immune function as well, right? And so, can you talk a little bit about the research correlation between GI health and someone's overall immune response and function?
Yeah. So about 70% of our immune system, by a lot of estimates and research, about 70% of our immune system, our immune cells, are found in the gut. And so that's a huge part of the immune system. And so it's why it's so closely tied to proper gut function, and why often when we're trying to balance immune function, we work on the gut. So that's a huge part of it. And it's also one of the reasons why I think we see things like lactobacillus and prebiotics and other probiotics being helpful for balancing immune function, is because they have such a big impact in the gut. So, so there are a lot of things that when we're thinking about treating immune function, they're actually gut treatments, but it makes perfect sense just because that's where so much of our immune system is.
Yeah, and I think that's important for people to understand. I mean, I think it's becoming more general knowledge that people have, with understanding the correlation between gut health and your immune response. But it's still good to remind people or make people aware of the basics of it for those that don't know. So when we're looking at immune function, I know that in my practice, there's a lot of things that we do for individuals who do a lot of intense physical training. So an instance would be like a marathon runner. There's studies that actually show how a marathon runner is actually more susceptible to being sick after a run. Part of it's due to the physical demand, or the demand of the physical training on their body. Can you tell me a little bit of how does intense physical training impact the immune system?
Yeah, that intense physical training leads to a transient but significant increase in some of the stress hormones and cytokines, both pro-inflammatory cytokines and even anti-inflammatory cytokines. And this is that cytokine production is part of the reason why we see more reactive oxygen species produced. So part of it, we were talking about reactive oxygen species and free radicals, and that creating oxidative stress when we don't have the right amount of antioxidants or antioxidant capacity. So part of it is coming from immune function. Part of it's coming from just the fact that we're oxidizing fats, carbohydrates, things like that to burn for fuel. But so we can see reactive oxygen species and free radicals created during intense physical training as well. So that can be another reason. But it ramps up white blood cells. It ramps up salivary IgA. So different salivary IgA is an immunoglobulin that lines mucosal surfaces in the body. So it's sort of a defensive mechanism there. So we're seeing white blood cell activity and immunoglobulin activity. And this is sort of ramped up during intense physical training, and there should be a decrease after that. There should be a balance, so it shouldn't stay ramped up. For some people, it does, and for those people, we typically need to modulate that immune system to help deal with that. Because you're absolutely right, the upper respiratory tract infections that marathoners and endurance athletes often get, that sort of stressor of the immunoglobulins being really active there is part of the reason why they have that strong immune response and they get this infection in their respiratory tract.
You talk about respiratory tract and infections with endurance runners. Have you seen anything in people who do like strength training or like just non-endurance runners? Have you seen any correlation with any kind of illness that they have, or not as much?
Not as much with the endurance athletes. It does seem like respiratory infections are pretty common. GI issues are pretty common. Mm-hmm. I would say with the shorter, more sprint-oriented runners, or the weightlifters, or where we're talking about sprint races, things like that, respiratory issues seem to be less of a problem from what I've seen, but it does seem to be pretty variable.
Okay. as you discussed, and we've discussed in some of the other episodes, this high intensity training does have a huge impact on a number of different systems, right? We've seen it affect. We talked about how high intensity training actually negatively impacts gut health, hormones, oxidative stress, and then now immune function. Can you kind of talk about what are some of the nutrients and supplements that you use to help balance the immune system and help restore that in athletes? Just as we did in the other topics where we talked about some things that we can do to help prevent the amount of damage that high intensity training does to our body.
Yes. So probiotics like lactobacillus, there's some pretty good data on lactobacillus that makes a lot of sense because of its role in gut health and balancing gut bacteria, balancing the microbiome. So that is one. Saccharomyces boulardii, which is kind of like, it's a probiotic yeast. So it's a little bit, whereas lactobacillus is a bacteria, Saccharomyces boulardii, which I'm sure you're using as well.
Yeah.
But it's a probiotic yeast that can help modulate the immune response at the mucosal surface of the gut. Quercetin, there's some pretty good data on that, which is a bioflavonoid and has some antioxidant activity to it. Omega-3s, so omega-3 fatty acids like fish oil, for instance, which is good not only for immune modulation, but for a number of other things, brain health, skin health, just to name a few. And things like beta-glucans, there's a little bit of, some mixed literature on beta-glucans, which are a prebiotic. Colostrum, which is an immunoglobulin that can bind to other immune complexes and can help lower the antigenic load in the gut. A little bit of data on ginseng and things like echinacea. We can't talk about the immune system without talking about echinacea. That
absolutely
always comes up. And then vitamin C is one of my favorites as well, which also has antioxidant activity and is relevant for other things in the body as well, and including glutathione recycling. So those are some of the things I think about to help balance immune function. But honestly, we end up going back to the gut a lot just because it's a cause and it's something that we can manipulate to help modulate inflammation.
Yeah, absolutely. Like you said, going and supporting that is going to be key to going and helping improve a lot of gut function overall.
Mm-hmm.
When I go and treat athletes, most of them are coming to me for an injury of some type, right? And so part of, and this is out of my own curiosity more than anything, part of the issue that I have when I treat athletes, especially very competitive ones, is that I'm working on treating them for an injury, and like for shoulder pain, something like that, knee pain. The thing that's the hardest for them to do is actually to shut down for a few weeks if they need to, so I can actually go and heal whatever issue they have going on. And a lot of them are very much, like type A. They want to go out, they want to continue to work out. They're just like, yeah, I'll push through it. And ultimately, I try and tell them, persuade them not to do that, because at the end of the day, it's going to cause more damage
Right.
when I'm trying to fix it. Is there any correlation with that type of personality and some of the impact it can have on immune function?
Yeah, you're absolutely right, and I've seen that as well. They're either pushing themselves too hard during training, so they're training. There's really three things. So, and the first one is they're really pushing themselves hard in training. Sometimes they're not allowing themselves enough recovery time before they go back and start training again. Or they're doing one specific type of training. And my mind always goes back to the example. This was maybe 10 years ago or more, when the NFL players started doing ballet. And I thought it sounds funny, and it's funny to picture that, but it was really a great idea because they were doing it to try and be a little more nimble, a little bit more agile, flexibility, things like that.
Yeah.
But it balances some of the intense training that they were doing on the field, which is great, because that's what I've seen in literature, is that if there's balance in the training routine, it gives the body a chance to sort of catch up. And then the intense activity becomes more valuable. So that mix of, moderate or light activity with stretching and things like that, and then intense activity at other times, I think works really well in it. So I think not overtraining is one thing that I see. Sometimes they're just carrying too much stress, particularly the weekend warriors who are putting a lot of pressure on themselves with work and with their sport. And I would say sleep seems to be a big one. And this sort of relates to that same type A person who's has to be the best at everything, has to do everything. And I think sometimes they're just spreading themselves too thin. They're training really early in the morning, or they're working late into the night, and they're losing out on sleep, which is important for recovery and has a big impact in immune function if we're chronically sleep deprived.
Yeah, absolutely. And just on performance overall as well.
Yeah, exactly.
To wrap up this particular episode, because immune function is so important in just every day, not necessarily just in performance, but just in everyday life. What are some things that you would recommend an athlete doing to kind of help improve or not improve their immune function, but as you said, balance it, which I think is a better term. I agree with you on that. I think it's a better term overall. What are some things they could be doing at home to balance their immune function while they're doing this high intensity training?
Easily the lifestyle stuff. And I think that is lifestyle and diet are two huge factors in trying to balance immune function. And by lifestyle, I mean stress management, sleep, those kinds of things can be really valuable. Nutrition wise, eating whole foods, minimally processed foods. That's, ideally it's personalized to the to the athlete and to the sport. So I think those are things that ideally you're going to get a lot of benefit from doing those things. The other thing is, we were talking about nutrients earlier, and also from what I was thinking when I have looked into some of the research on these nutrients and immune function in athletes, it seems like what I've seen is that the single nutrient approach does not seem to be as effective as the broad spectrum strategy. And so, in other words, just using lactobacillus or just using quercetin, it seems like by combining some of these things that support gut health and some of these antioxidants, that seems to be the way to really make some progress in inflammation, oxidative stress, and immune function. So a balanced approach, which makes sense. That we don't want to overdo one particular nutrient. And also too, I think we talked about this with the detox, our detox podcast too, that it seems like if we can overdo some antioxidants. So more is not always better when it comes to antioxidants. So that's one of the reasons why we test, is to figure out, does this patient have a lot of oxidative stress? Do they have a lack of antioxidants? How do we get that balance right? Because that touches on immune function as well.
Yeah, absolutely. And when we're looking at checking to see how well is someone's immune system working, what are some of the things that you look at to determine, okay, yeah, your immune system's in check, or no, it's maybe out of whack, we need to go and fix some of it? What are some of the things that you look at? Are there particular tests, different things like that?
Because of the connection to gut health, I do look at I look at stool testing, and I look at immunoglobulin testing, particularly for reactions to foods. So those are two of the ones that I think tell me the most about immune function. So the stool testing markers, I like to see fecal secretory IgA, which tells me about that immune response in the gut barrier. If they've got a history of IgE reactions, I like to see how their EPX, eosinophil protein X, looks. So those are markers we can get in stool testing pretty easy.
Okay.
And then for immune testing, I am typically looking at immunoglobulins for IgGs in particular. And if I'm seeing patterns of permeability, which we talked about a little bit in our digestive efficiency podcast. If I'm seeing patterns of permeability and I have my clinical suspicion is high, then I'm generally working on that. And then telling them to avoid any foods where they've got strong reactions. So those are typically the things that I'm looking at, and maybe looking at oxidative stress markers just because that's could be related to immune function as well. But yeah, are you using any tools that you feel like are really helpful?
Nothing that you haven't said yet. It sounds like we pretty much have the same approach for it. The food sensitivity is going to be one big thing, and we talked about that in the GI episode. One of the things that I do ask is history of antibiotic use and how often they've been doing, or how many antibiotics they've taken roughly in their lifetime. And that, again, that goes very much to the gut health that you talked about, and just having a bacterial flora imbalance, if they've been on a lot of antibiotics.
Good point.
And then, aside from that, I think most of it's going to be just GI health, and then, just understanding how often they're getting sick, stuff like that. Once a year, I'm not super worried. I think that's obviously a good thing. When people come in and say, "Oh, I haven't been sick in years," then I might be a little concerned because, your immune system needs something to respond to. So, if you haven't been sick in a long time, that might be a red flag as well.
Yeah, I agree.
But aside from that, I think you touched on the same testing that I use. We covered a lot on immune function today. Is there anything else that you'd like to add, Dr. Warren?
No, I think that's it. If there's, I can be reached through my website, www.caforsport.com. That's the number 4. And I'd be happy to help. Feel free to reach out if you've got any questions. And it was great to be on the podcast again. I've really enjoyed the series that we've been doing, and it's always great to catch up with you.
Yeah, likewise. As Dr. Warren said, you can check out his website, Clinical Advance for Sport. Link to his website is in the description. And then otherwise, thank you all for taking the time to listen to this particular episode. We'll be wrapping up the series next week with structural integrity. So Dr. Warren, thank you so much for being on the show again.
Thanks, Dr. Matt. It's been great to be here.
Perfect. Thank you all for listening, and we'll catch you on the next episode.
Having issues with low energy and staying mentally sharp? Your hormones can play a role on how much energy and focus you have throughout the day. Our team at Ethos Integrative Medicine loves working with busy individuals who want to feel their absolute best and get the most out of life. Ask our team how you can get more information to learn about our unique approach to hormones so you can continue to take on the world.